does. All right. Thank you everyone for joining us. This is our first installment of the 2024 Small Ruminant Webinar Series. And tonight we are joined by Maggie Highland from the University of Wisconsin-Madison State Veterinarian Diagnostic Lab. I've gotten to know Maggie over the past couple of years and I enjoy working with her. Very interesting, her work. But before I turn it over to her, I'm going to put up a poll, and our poll just lets us know who's here and what you're doing on your farm. So just give me 1 second to activate that. And I hope you're all seeing that and have a chance. I'll just give you a minute or so to answer the questions, and then hopefully anybody who's coming in late can also join us. I see some answers coming in. There's a lots of options. Recently, Iowa State University Extension and Outreach and UW-Madison Division of Extension have collaborated to create a small ruminant outreach specialist for both states. So that's why if you've joined us in the past and you've just seen the Wisconsin options, now we also have Iowa options. So hopefully we have a lot of people from Wisconsin and Iowa joining. And thanks for those of you who are joining outside of Wisconsin and Iowa. And our polls are anonymous, so no worries about that. All right, I think I'm gonna hit for 82%. We're at 80%. Oh, we got it. I'm gonna end the poll, so I'm gonna give you all just one or 2 seconds to finish, and then we're gonna hand it over to Maggie. Thank you. Okay, Maggie, it's all yours.
Okay, thank you, Carolyn, and thanks for inviting me to do this, and welcome everybody. Hopefully this provides a good resource. It's going to be a whirlwind probably of information that I'm going to provide. These are 2 pretty big topics, so I'm just going to touch on a few infectious diseases for each of these and then go into a bit of detail more focusing on abortions and diagnostic testing and sample collection, etc. So with that, I can get started. If my slide will advance. There it goes. So
Maggie, before you get too deep in it, why don't you introduce yourself and give a little bit more of your background quick?
Oh, sure. I can do that. I was actually going to do that, but I wouldn't take the time. But thanks, Todd. I will. I'll take advantage of that opportunity. So my name is Maggie Highland, and as Carolyn said, I'm currently at the Wisconsin Veterinary Diagnostic Laboratory. So this presentation will be from the perspective of an anatomic pathologist and diagnostician. So I have a PhD in infectious disease and immunology, focusing on small ruminants. I received that through the USDA at WSU. My training as a DVM was at UW-Madison, and then my residency in anatomic pathology was at UC Davis. After that, I spent 2 years back here in Wisconsin as an anatomic pathology fellow with the Milwaukee County Zoo. And then following that is when I went to Washington State with the USDA as a USDA PhD trainee. And my main focus out there was I talk a bit, probably extensive on this topic, was in Mycoplasma ovipneumoniae and interface issues between domestic and wildlife, specifically bighorn sheep in the West. So that was the main focus of my PhD program project with the USDA. After completing my PhD, I stayed with the USDA for 3 years and continued doing research focusing on Mycoplasma ovipneumoniae. After that, I went to Kansas State for just shy of 3 years as a diagnostician at the Kansas State Veterinary Diagnostic Laboratory. And then an opportunity that I could not pass up to come back home to Wisconsin opened up at the Wisconsin Veterinary Diagnostic Laboratory. And here I am and have been for the last year and a half. So that's a rundown of who I am and my training and background. When I talk about infectious diseases, I always take the opportunity to just give an overview of the fundamental concept of infectious disease. And really this Venn diagram explains the three primary entities that are involved for a disease process to occur. And I had learned it in veterinary medical school as the beast, the bug, and the burden. Rolls off the tongue better, but the beast being the host, so you need a susceptible host. The bug being the pathogen, the infectious agent, and then the environment. All three of those have to come together for an animal to contract and develop a disease process. So while I'm on my soapbox here about infectious diseases and the importance of the beast, the bug, and the burden, there's a term that's frequently used, and it raises the hair on the back of my neck when I hear it, and that's the term disease transmission. And this is important. This is an important concept, I think, because diseases are not transmitted. Diseases are what can occur once transmission of an infectious agent happens. So again, diseases are not transmitted, pathogens are transmitted. Disease is a potential outcome of that transmission, and it's really dependent on the host and the pathogen and the environment. So animals that are under stressful conditions, overcrowding, etc., are more likely to actually progress to a disease process progresses given the right environment in a susceptible host. So really important concepts. The beast, the bug, and the burden are all important factors when looking at infectious diseases and understanding them and understanding how to prevent infectious disease processes. So we'll start with the topic of pneumonia. So causes or etiologic agents include parasites. So those are the lungworms, and I have a list of the different lungworms that can impact sheep and goats. Bacterial causes, Mycoplasma species, and again, the one that I'm going to primarily focus on a little more in detail this evening is Mycoplasma ovipneumoniae, but there are other Mycoplasma species that can be associated with respiratory disease in sheep and goats. And then there's the Pasteurelliaceae family of bacteria, and that includes Mannheimia hemolytica, Pasteurella maltacida, Biebersteinia trehalose. And for diagnostics for parasites, for live testing, the Biermann fecal flotation technique is a good way to determine whether an animal is carrying lungworm. And then samples for diagnostics, and this are post-mortem samples that I'm talking about, or so after death samples, particularly for bacterial and viral agents, which I'll show on the next slide. Collection should be representative lung tissue of abnormal, normal, and then really important is to get at the junction between the two. And then we want fixed and fresh tissue. So fixed tissue is what we use to look at tissue histologically. So using a microscope, light microscopy, can give us some good indication of what's going on in the lung on a tissue level. And then fresh pieces, and we want pretty good sized pieces. I always learn you want it kind of the size of your fist if you can. And that's to do culture and potentially molecular diagnostics, which we can use for PCR is called. So that can be useful in diagnosing viruses in particular. And here we have the three of the viruses that can cause pneumonia. These particularly impact kids and lambs. And then there are the retroviruses, which include the caprine arthritis and encephalitis virus, or CAEV. However, pneumonia is not typically the presentation for this virus in goats. And then an important retrovirus that impacts sheep and is fairly prevalent in the United States is ovine progressive pneumonia virus. And I'll cover that one in a little more detail. So Mycoplasma ovipneumoniae, we'll start with just a typical gross appearance of the lung. What we'll see when you open that animal, you have consolidation, which just means hardening or a firmness to that lung. And it's typically, so the head would be to the left of the screen, the caudal aspect or back by the diaphragm, the butt area back here, and it's that cranioventral. So down in the front area of the lung is typically the most affected area of the lung, and you usually have a pretty good line of demarcation. And again, red, firm tissue. You open these, sometimes you'll see, if you cut into this lung tissue, sometimes you'll see pus within the bronchioles. And often this organism is associated with secondary infections, which we'll talk a little bit more about. And that's where those Pasteurella organisms come in. So the Mannheimia, Pasteurella maltasta, Biebersteinia. So I consider Mycoplasma ovipneumoniae to really be a primary respiratory pathogen, which leads to pulmonary bacterial infections, which are secondary bacterial infections. Mycoplasma ovipneumoniae colonizes the respiratory tract, so along the epithelium. In doing that, it impedes the mucociliary clearance. So mucociliary clearance along the trachea and the bronchi, you have little almost hair-like projections that normally bring bacteria up and mucus up or dust up, whatever's inhaled that shouldn't be in the lungs. So it's kind of like a little escalator that brings bacteria, or like I said, dust particles, things like that up, and mucus up out of the lungs. Mycoplasma ovipneumoniae can impede this clearance by colonizing along that cilia and down into the lung lobes. In and of itself, often mycoplasma is not a fatal, or does not cause death in an animal due to the infection. It's often that it causes this compromise. It compromises the lungs, and then those secondary, more virulent pathogens can fall into the lungs, such as Mannheimia hemolytica or the Pasteurella maltasta, and some of the Biebersteinia trailosii bacteria. Mycoplasma ovipneumoniae is often associated with a chronic pneumonia, and it's typically in young animals. Some of you may reference it as being a coughing syndrome or barn cough. It often occurs when in human environments, so like, or summer cough, I've heard it called, in animals, particularly in the Midwest region where it gets humid in the summer. This organism was initially reported as being species specific. So for years, it was thought to only be an infectious agent of sheep and goats, both wild and domestic. But this is not true. Research that I've done and continue to work on has shown clear evidence that this impacts deer species pretty heavily, actually. And in farm deer in particular, it's probably their primary agent of pneumonia in farm deer. It's proven to be a pretty important infectious agent in captive whitetail deer at captive whitetail deer farms. M. ovipneumoniae has a pretty high prevalence across the United States in sheep flocks. There was a USDA NOMS sheep study performed in 2011, and you can see the statistics there, that 88% of the 453 sheep flocks that were tested in 22 states did have detection of ovipneumoniae present. That study didn't look at prevalence on individual farms. It looked more just to see the distribution and prevalence overall in different farms and in ranches. In 2019, NOMS did a goat study, and they sent samples to me. So I was lead on this study for NOMS, the 2019 NOMS goat study, and that was used to investigate the prevalence in goats. So the data is still under analysis. It's sitting right now with the USDA APHIS folks for statistical analysis to determine prevalence, not only overall prevalence on farms, but in-farm prevalence. So that we tested, I believe it was 8,600 individual animals for that study. So hopefully within this year, we'll have that data out. Diagnosed, I think, for so long, not only in sheep and goats. It wasn't until 1962 that it was first diagnosed in New Zealand and Australia as being the cause of this atypical pneumonia or the chronic coughing syndrome in sheep and goats in Australia and New Zealand. This is because it is so difficult to culture. And it is often when culture is performed by the standard aerobic culture techniques in a laboratory, the more easily cultured bacteria are diagnosed and considered the cause of the pneumonia. And again, we go back to those Pasteurella bacteria that are often found. If you have a mixed culture where you're getting Pasteurella maltosida, Mannheimia hemolytica, Biebersteinia traelosi, two or more of those, and sometimes other bacteria too, like you'll get Trupperella pyogenes out of there sometimes, and sometimes some of the anaerobic bacteria, which are a little more of a nasty bacteria like Fusobacterium. I would look for an underlying cause such as Mycoplasma when if you've been submitting tissues and getting mixed bacterial growth on those lung cultures. PCR, or what we call molecular testing, has improved the detection vastly. And right now, there are a few diagnostic laboratories that offer PCR testing for Mycoplasma ovipneumoniae. Unfortunately, Wisconsin Diagnostic Lab hasn't yet validated testing for this, but it is offered at Kansas State Veterinary Diagnostic Laboratory. I assisted, I didn't develop the assay, but was the driving force for the assay to be developed at Kansas State. I think that's a pretty solid molecular test that they offer. There are a few other diagnostic labs, though, like I said, that will offer that PCR testing. This organism is difficult, perhaps even impossible to treat and clear. Antibiotics typically just control those secondary infections. And you can try to keep it out of a flock, but this can be really difficult with large flocks. It can also be difficult to identify carrier hosts by just doing nasal swab testing. I've done repeat testing on farms that for sheep and goats, and animals don't always have a detectable level on that nasal swab, even by the PCR method or that molecular testing method. So detection can be difficult. So accurate diagnostics are challenging for this organism. So it can be tough to clear, and it can be tough to keep it out of a herd unless you do repeat testing and isolation prior to introducing new animals. So next, a little bit about ovine progressive pneumonia virus. So this virus was first described in Iceland, and where it was named Madivisna virus, or MVV. Madi means dyspnea, so difficulty in breathing, and then Visna refers to the wasting that occurs with chronic infection and disease from this virus. This virus is very closely related to CAEV. And there are a few reports of OPP infection in goats. However, this is rare. Infection with OPP virus results in persistent lifelong infection. It can't be cleared from the host. There are sheep that do remain subclinical their whole life, their natural life on a farm or ranch. And these are considered silent carriers, and they're often a source for infection in a flock. So pneumonia is the most common form of disease with OPP. It's a prolonged insidious disease. You'll have that chronic weight loss or wasting. It typically doesn't impact animals until they're greater than 2 years of age, and more commonly, it's seen this like this animal, this progressed disease in animals that are greater than 5 years. You'll see animals stretching and extending their neck to breathe. The first case that I had seen that was progressed in an older animal that was 5 years old, I thought the animal had some sort of colic or ileus going on. It looked more like abdominal pain because they were stretching so much just to try to get air. So it can fool you. And she wasn't in that poor of body condition either. So it can be an animal's behavior can be a little bit tricky with that one, but often you can see them gasping for breath towards the end stage of this disease. The other entity, and we're not talking about mastitis tonight though, that OPPV can cause is mastitis or hard bag. So transmission of OPPV, the virus is shed by asymptomatic and symptomatic infected sheep. There can be horizontal transmission, so this can occur via aerosol or direct contact between animals. It can be shed in respiratory tract secretions in the mucus and saliva, which they think may be the most important source of virus transmission between animals. It's been detected in the urogenital tract. It says trace, that's supposed to be tract. So in urine, vaginal secretions, and in semen. And if animals are in close confinement, so again, the environment playing a role, and crowding, this can increase transmission, and that's typically true of any infectious agent. Vertical transmission, so that means from the dam to the offspring. This can occur through colostrum. This is thought to be to account for approximately 20 to 30% of the transmission that occurs within flocks. In utero transmission, so crossing the placenta, to the fetus, it's considered to be a pretty low likelihood. I have no idea where that 12 came in there. So there's also iatrogenic, and that means human-induced transmission. So this can be caused by reuse of taggers or needles. Treatment and control, there is no control, there is no vaccine. So currently the only method is to control the disease, and that's via test and cull of infected animals. And not to go into too much detail with the rest of this for time's sake, but there is a really good resource for information, and that is at this OPP society.org out of Minnesota. And they have steps for eradication and control of this infectious agent within flocks. So I would recommend having a read through that page if you're interested in learning more about OPP. So we'll move on to small ruminant abortions causes. So I have these listed out in a table, and it's quite a long list, and it's probably not all inclusive. So the protozoal agent that I'll cover just a little bit is Toxoplasma gondii. Some of the more common bacterial agents or bortogenic agents include Coxiella burnetii. That's the name of the disease in humans, but often you'll hear Coxiella burnetii referred to as Q fever. Chlamydia, Brucella species, both abortus and ovis, Campylobacter species, Listeria, Leptospira species. There are mycoplasmas that can cause abortion, and other bacteria, opportunistic bacteria. And then viruses include Cache Valley virus, border disease virus, and bovine viral diarrhea virus has been reported in sheep and goats, and then blue tongue virus and caprine herpes virus 1 in goats. So non-infectious causes, briefly touch on these, both broomweed and local weed. I do not think those are common to this area specifically. They're more southwest and west. mountainous areas, and then the more arid Southwest. But just worth mentioning and showing a couple of pictures here of what those plants look like. Another non-infectious cause of abortion. It's not common in sheep or goats really, but primarily it impacts cattle is nitrate toxicosis. And it can occur due to nitrates accumulating in plants. And then levomasol, it's a dewormer, and that can be associated with abortion when given in late gestation in sheep and goats. And then another non-infectious category for a cause of abortion, stillbirth, or weak kids include nutrient deficiencies such as vitamin A, E, selenium, copper, magnesium, and then iodine. In the case of iodine, both excess or deficiency in the dam can result in goiter in the fetus. So a little bit on Toxoplasma gondii. Cats are the definitive host for this protozoal organism, and many mammalian species are considered intermediate hosts, including humans. So this is a zoonotic. So zoonotic just meaning an infectious agent that can be transmitted from animals to people and cause disease in people. This is the primary reason that it's recommended that pregnant women don't clean a litter box if they have a cat in the house. Oral transmission route is the primary route of transmission, or the route of transmission. Feces contain the infectious oocysts, or the infectious particles for this protozoan agent, and tissues are also another source that contain the protozoal cysts. So doesn't seem like it would be a big issue since but contamination of the ground with tissue from animals, intermediate hosts that have this protozoan organism. So milk containing infectious form of the protozoa, or the tachyzoites they're called. There are reports of infants and children becoming infected after consuming unpasteurized goat milk. Placental transmission can occur from dam to fetus, and this typically results in third trimester or late term abortions and stillbirths. So for this particular agent, it's really important to submit the placenta. That's the primary site in the animal or in the fetus that's impacted, with the highest level of protozoan parasites being located there. So a plug to make sure to submit placenta for diagnostic workups. Chlamydia abortus. The sources of this bacterium can be through semen of infected bucks and rams. Large numbers of this bacteria can be shed in the fetus, shed in placenta, in the fetus itself, in amniotic fluid, and in uterine secretions. Infection is by inhalation, ingestion, or it can also be transmitted through the venereal route, so during breeding. It crosses the placenta, and abortion typically occurs during the last 2 to 3 weeks of gestation. So you can have a true abortion or a stillbirth or weak neonates born. This agent can cause abortion storms, where you can have upwards or around 60% of loss. And it's referred to also as enzootic abortion of sheep or enzootic abortion of goats. You may see concurrent pneumonia and arthritis and conjunctivitis and retained placentas in does and in the ewes. I have just does listed there, but does and ewes. And this agent also is zoonotic, so can infect humans and cause disease in humans. And again, important to submit placenta for a diagnostic workup to diagnose this agent. Campylobacter species, of the two, so there's Campylobacter jejuni and Campylobacter fetus. I would say Campylobacter jejuni in small ruminants is probably the most important of these two. Source of this agent is often due to introduction of new animals that carry bacterium in the intestine. So you can have a healthy carrier of this organism and it's shed in the feces then. Often this can be due if you bring in a new ram or a new buck during breeding season. And then you'll see the impacts in that year's offspring crop. Infection with this also occurs by fecal oral route. So carrier animals, again, shed the bacteria in the feces. And then susceptible animals that do not currently carry it, it's new to them, they will pick it up and it can then transmit from the host, so from the ewe or the doe, and into the fetus by transplacental transmission. And then abortion with this one also typically occurs during the last 2 to 3 weeks of gestation. And you can see stillbirth or weak neonates as we described with the chlamydia agent. This too causes abortion storms. It's been referred to as vibriosis, and this often can result in really high losses, upwards of 80% or so in a naive herd or flock. This also is a zoonotic agent, so can infect humans and cause disease in humans. Amniotic fluid, so this is the fluid that is best collected from the abomasum or the stomach of a fetus. This is really the best diagnostic sample, and we'll cover this again in a bit for when I go over performing a necropsy and tissues to submit for diagnostic workups. So this is a really important point, and it was first identified, I believe, in 2002 that C. jejuni, again, the most important Campylobacter species to be concerned about, due to it being much more common than C. fetus in the United States. And I would border on saying 95% plus of the currently circulating Campylobacter jejuni strains in the United States are tetracycline resistant. I have a reference here for more information on alternative. It discusses some of antibiotics that can be used as alternatives. And my first experience with this and my first discovery that this was a thing that there is a high tetracycline resistance in Campylobacter jejuni was in a very large, I want to say 3,500 flock ranch in the Western United States that was undergoing an abortion storm. By the time they submitted the first lamb, and it was within days, they had lost several hundred abortions already. And we tested for resistance, antimicrobial resistance, and it was tetracycline resistance. And after doing some investigation, it turns out there was a publication as early as 2002 that described the high level of tetracycline resistance in Campylobacter jejuni. So not a good first choice to go to at all if you are experiencing an abortion storm. Next agent, Coxiella burnettii, or Q fever. The source of this bacterial agent is from infected host feces. It can be shed in urine, milk, vaginal secretions, semen also. And it can be found at a pretty high level in the placenta and the amniotic fluid. Hosts include goats, sheep, and cattle, and there are other hosts that can be carriers, such as dogs and cats even. Ticks are reported to play a pretty minor role in the transmission of this agent. So it's thought to be, again, more of that fecal, oral, or any of these other sources of infectious materials being ingested by the host. And another infection can also occur by inhalation and by venereal routes, so during breeding. So the important thing to know about this, I guess, two things. One, it is zoonotic, so that it can cause Q fever in humans. And it has a really low infectious dose. So it's been reported that as few as one viable or one live bacterium can cause infection in a host. The route to get to the fetus once the dam is infected is that transplacental transmission. So the animal goes bacteremic, so the bacteria travels in the bloodstream and then crosses the placenta. Once it infects the placenta and the fetus, it can result in late-term abortions, stillbirths, and weak neonates. And this is a reportable disease agent in most states. So most states, the state veterinarian, it needs to be reported to them. So Listeria monocytogenes or listeriosis, this bacteria can be found in soil. It's a pretty ubiquitous, so often found in soil, can be found in various environments. It likes to propagate, though, to sort of an infectious level in spoiled hay or silage. And it can also be shed in feces and in feces. So it can be carried in the intestinal tract of a host and not cause a whole lot of trouble. But it's in those pregnant ewes or dams where it can cause disease if it goes bacteremic and crosses the placenta. So infection is typically by the oral route. And a little bit more about the bacteria found in the environment. It's often in wet environment where animals will pick this up. So once an animal, once transmission occurs through the oral route, animal goes bacteremic, so it means the bacteria is circulating in the blood. It can get to the placenta and through the placenta where it can infect the placenta and the fetus, and it can cause sporadic abortions in sheep and goats. The fetus is often autolyzed, or you can see stillbirth or weak kids towards the end of gestation. The autolysis is just the breakdown of that fetus within the uterus because it doesn't cause abortion right after the death of the animal. So the dam will hold the fetus for a period of time prior to expelling it. So this bacteria can be found in milk. It's one of the driving forces for pasteurizing milk because it is zoonotic. It's it can cause foodborne illness. And it can be shed by clinically normal carriers or ill does in ewes. So the does can become sick from this also in ewes. You can also see metritis following abortion, and this probably has to do with the fact that the ewe doesn't immediately expel that dead fetus. So it sits in there and autolyzes and compromises the uterus and kind of setting up shop for metritis or inflammation of the uterus. Brucella ovis. This primarily affects rams where it causes epididymitis and which can result in poor fertility. It's not common, but it can cause abortion and perinatal mortality. So kids or lambs that are born, they can be born weak and die shortly after. Ewes and does both are ewes, not kids, sorry. Ewes seem to be resistant to this infection though. So Brucella ovis impacts sheep, not sheep and goats. I'm on the sheep and goat both mode here. Ewes seem to be resistant and they can clear the infection. This is unlike rams, again, that can be the carriers where they get epididymitis and the bacteria lives happily in the reproductive tract. Unlike most Brucella species, this is not considered a zoonotic agent, though it though it is reportable in most states, but it is not zoonotic, so not a threat to humans. Brucella abortus, just a little bit on that because it has been reported, although rarely in sheep and goats. This one is it's not a foreign animal disease, but it's definitely reportable and it needs to be reported quickly. Most states are considered free of this agent. Not a foreign animal disease, but it is foreign to many states within the United States. It seems to have just nituses of infection, such as Michigan and the Yellowstone area. So Leptospira bacteria species, there are different serovars of this bacteria, and its source, it is shed in the urine of carrier hosts. So depending on the serovar, it's shed by different animals are considered, or different species are considered the host species. So like Bratislava is thought to be carried more by pigs, for example, ictrohemorrhagia by mice and rats. So one of the big sources of Leptospira is rodent infestation and urination within feed material. So once it's shed in the urine by carrier hosts, it can survive for months in contaminated water and feed and soil. The maintenance or source hosts vary between, like I said, between the different serovars. But rodent control is important in prevention on this one. Infection is due to the oral route, so ingestion of those contaminated water and feed sources. It can also be contracted through breaks in the skin or mucous membranes, so through the eye or mouth. And bacteremia in the dam can result in transplacental transmission again, and you'll see typically more of the sporadic abortions and stillbirths rather than abortion storms with this. It can be shed in milk, and it is reported to be a reported cause of hemorrhagic mastitis. And again, this is a zoonotic agent. So some of the Mycoplasma species that have been reported as causative agents for abortion in small ruminants include Mycoplasma agalactia, also an agent of mastitis, and then Mycoplasma putreficans, and there are a few others. And these are typically considered a less important infectious agents of abortion in sheep and goats. But that transplacental, or it can be transplacental where it infects the fetus, or it can be due to ascending infection through the vaginal canal that results in fetal infection. And typically, these Mycoplasma species result in a late gestational fetal death. And again, as with Mycoplasma ovipneumoniae, many mycoplasmas, not just ovipneumoniae, are quite difficult to culture just due to their fastidious nature. They require special media, and even then, they don't always like to grow. So PCR detection has really improved the detection of these agents, not only for Mycoplasma ovipneumoniae in respiratory disease, but also in the agents that cause mastitis and abortion. We'll move on to viruses. This is an important one, and it is pretty ubiquitous, I think, across the United States. Now, I just recently learned how common it may be in Wisconsin even. So the source of this is mosquito, the doe or the ewe, and I have just doe there, but doe and ewe are infected with little consequence to them. So if they are bitten by a mosquito, they don't seem to show many symptoms. They may have a spike in fever that goes unnoticed, but really little in the way of clinical symptoms. And then again, once the mosquito has transmitted this virus to the host, it goes viremic. So the virus is circulating in the blood where it gets to it gets to the placenta and crosses the placenta and it can cause abortion. And aborted fetuses are typically show signs of arthrogryposis, which is in this image at the bottom. So that just means twisted limbs on those fetuses, and then poor muscular development or muscular hypoplasia. So they just don't have that normal musculature at birth. And then also an important one are the CNS lesions or the brain lesions. So it's important to look at the brain, and I'll cover this a little bit later. Also, what you'll see in the brain. This is zoonotic, but only in the sense that it can be spread by mosquitoes to humans also. There have been human reports of Cache Valley virus also, but it requires that host it requires the mosquito picking it up from a host to transmit it to a human. So diagnostics are pretty challenging for this particular agent, and I'll talk about that in just a slide or two from now also. But diagnostics may be useful to use PCR. So that's molecular testing on tissues that are collected from the fetus. And again, there are limitations to being able to detect this virus, because the fetus and the ewe clears the virus, and the fetus can clear the virus within 4 to 6 weeks of becoming infected. You can use serology on the dam to determine whether or not they've had an exposure. It doesn't necessarily mean that's the cause of abortion, but if an owner is interested in knowing exposure for their flock or herd, you can do serology testing on the dam. You can also test the thoracic fluid if the fetus is greater than 85 days in gestation. It can be a useful way to diagnose this in the fetus also. And here is a picture, I guess I have one on here also, of what the brain might look like if you open. So what we're looking at here, I don't know if I think my arrow is showing up. You'll see collapse of the cerebrum of the brain, so main part of the brain here. And this animal also has a pretty small cerebellum, but really hydrocephaly. So this collapses due to the fluid leaking out of the brain. So hydrocephaly in this case, and then arthrogryposis, two of the main findings that you'll see with Cache Valley virus. As far as infection in the fetus, if the ewe is infected and it's transmitted to the fetus between 28 to 32 days of gestation or before, the lamb or the fetus usually dies. So you'll see early embryonic loss. Later, you may have a small mummified or dried out fetus that is expelled from the dam. And you can also see infertility. So this could go unnoticed depending on how early the abortion occurs or the fetal loss occurs. Between if the fetus is infected between day 32 and 48 of gestation, that's when they survive that time. That's where you'll see those late term abortions or stillbirths, where they have the musculoskeletal and the brain malformation. So again, here's a picture that Todd Taylor kindly shared with me not too long ago of a lamb that has kind of this twisted and just has kind of a small rump area, so poor development of musculature, and then the legs are twisted and locked into place. And then if a fetus is infected after 48 days of gestation, typically the lambs will be normal. They'll clear the infection with no problem. So this is where diagnostics becomes tricky, right? If the fetus can clear the infection within 4 to 6 weeks of becoming infected, for these animals that have these malformations, they may develop these malformations, continue to develop abnormally in the uterus, and then have these obvious malformations when they're expelled or stillborn. But the virus could be long gone. So it's already done its damage and has cleared. So definitive diagnosis is pretty difficult. However, you have a pretty good sense that that's the causative agent if you see both the brain malformations and this crooked limb type syndrome and low muscle development. So border disease virus, let's see, how am I doing on time? Oh, pretty good, talking fast. Border disease virus, this virus is very closely related to bovine viral diarrhea virus, so BVDV, which is typically, as the name would imply, in cattle. And its source or transmission, carriers can shed the virus in saliva, feces, urine, placenta, placental fluids. Persistently infected sheep are a source of infection in a flock. This can also impact goats, but persistently infected goats are pretty rare, but it has been reported. Diagnostics and prevention to get it out of a herd or a flock. You want to test animals, and for those that are seronegative, so they do not have antibodies circulating, but they do have the virus detected by PCR or molecular testing, you want to cull those animals because those are the ones that are shedding the virus, but they don't have an immune response to it. So they were infected in utero. They became infected in utero and were born otherwise normal. And they actually consider, if you want to say it this way, they consider the virus to actually be a normal part of themselves, so they do not develop an antibody response to it. Transplacental transmission. This occurs when a non-immune female becomes infected while pregnant. If infection occurs prior to 60 days of gestation, you'll see resorption or mummification, or small weak lambs that are born. Rarely you'll have lambs that are born normal, and these are the animals that become that persistent infection, and the animals that are a source of infection for the flock. If infected greater than 85 days, you'll see abortion or weak lambs born, or you can also see animals the fetus could be infected and still develop normally, but they'll be virus negative at the time of birth because they have cleared the virus. So, and the timing of infection is really important on this. You'll see grossly identifiable congenital malformations. And here's an image of the more classic hairy shaker lambs. So this virus, as with BVDV in cattle, it impacts the central nervous system. So it impacts brain development. So you'll have lambs that shake, and it also impacts their coat. So the wool, they have kind of a fine curly hair-like consistency for the wool. And again, the brain, you'll see similar lesions as we described with Cache Valley virus. Actually, you'll see hydrocephalus or poorly formed cerebellum. BVDV can infect sheep and goats. It can cause pregnancy loss, abortion, stillbirth, fetal congenital malformations that are very similar to border disease virus. You'll see neonatal morbidity and mortality, so death shortly after birth. Cases of persistent infection are rare. If you have this in sheep or goats, you can, but again, it goes to remove it from a herd. Again, you want to cull the animals that are seronegative, but have PCR detection of the virus being within the host. You can see mild postnatal infection or mild disease in animals that are infected, and this can be leukopenia, so low white blood cells, and then fever in animals that are infected after birth. Blue tongue virus, adult goats and sheep. I have just goats there, but this goes for sheep too. They rarely show any clinical disease with blue tongue virus, but they can. I've seen sheep with blue tongue when I was a resident at Davis. They probably are a little less resistant, but goats seem to be pretty resistant to blue tongue relative to sheep. Source of transmission is biting insects or biting midges are the main source. And live vaccines can be a cause of abortion if you vaccinate a pregnant animal, since the vaccines for this virus are live vaccine. And this picture just illustrates how severe that hydrocephalus. So this is a head with kind of the top part cut off looking down. So there's really no cerebral development, and the hemispheres of the cerebrum have just collapsed down as soon as the skull cap was taken off. So really no development of the brain in this case. Viremia in the doe or in the ewe, more typically it would be, can result in, again, the transplacental transmission of the virus to the fetus and the fetal infection. This can result in abortion, mummified fetuses, or congenital defects as shown in this picture, particularly defects impacting the brain. So just an overview then of viral abortions and how similar and how to differentiate. So really the only virus that we have in the United States that will cause both arthrogryposis, or the twisted lamb and poor muscle development, and CNS or brain lesions or abnormalities, is Cache Valley virus. So if you see an animal that has the twisted limbs, poor muscle development, and poorly developed brain, or the hydrocephalus, so water in the brain and poor cerebral development, you can bet that it's Cache Valley virus, but remember, again, to confirm that can be really difficult, just due to the fact that the virus clears even from the fetus within 4 to 6 weeks, and the infection, occurs within the first couple of months, and then it results in these congenital malformations. With CNS lesions, in the absence of arthrogryposis, or the twisting of the limbs, those can be caused by border disease virus or the bovine viral diarrhea virus, BVD, and blue tongue virus. Arthrogryposis is rare, if really ever diagnosed with these 2 viruses, or 3 viruses if you include BVD in there. And then if you see just the arthrogryposis, or that twisted limb type syndrome, there are some genetic associations that can cause that. And there are also toxic plants that can cause arthrogryposis. But if you don't have CNS lesions present, you typically can put the viral agents lower on your list of differentials as a cause for the abortion. And then the final one that I'll cover is caprine herpes virus 1. So goats only on this one. Transmission is considered, it can occur through the venereal route, so during breeding. You can have latent infections in adults, so meaning an animal can be a carrier and then shed periodically. It can result, infection can result in a vulvovaginitis or velanoposthitis, which just simply means erosions or vesicles that can impact the penis, prepuce, vulva, or vagina of the host. Transplacental transmission of animals that go viremic again, so it recrudesces like a lot of herpes viruses can in many species. This can result in the virus crossing the placenta and then infecting the fetus, resulting in abortion really at any gestational age. It's often reported late term as a cause of late term abortions though. And in the fetus, you typically will really see no lesions, and histopathology, so microscopic, looking through a microscope with light microscopy, you can see lesions and changes in liver, lung, and kidney, so important tissues to submit for diagnosis on this one. And it just looks like very, very small microscopic areas of necrosis of these organs. The neonates may develop a systemic disease. If they are infected, they can develop fever, anorexia, dyspnea, all those things you see listed, ulcers in the intestinal tract, pneumonia, conjunctivitis, and often when young are infected, this can result in high mortality. So my primary question after learning about this, and I still have this question, and I'd be interested to hear from anybody in the audience if you've had this occur on your premises or you're familiar with it at all. I can find really nothing about the prevalence of Cape Rhine herpes virus 1 in the United States. It's reported to occur. I just don't know how frequently it occurs, and I've never personally diagnosed it. So performing a necropsy and sample collection, we'll move on to that. So, so if we get an animal or a fetus into a diagnostic laboratory, we do what you see in the picture to the left here. We do a crown rump length. We have that gives us a good idea of the gestational age in a developing fetus, or approximate gestational age of the fetus. We check for congenital malformations like cleft palate, so we look in the mouth to examine for that. We make sure, this picture is just to illustrate that we make sure that the anus is patent, so there's no atresia, anal atresia. The very first sample that I collect, that's recommended to be collected when you first open that abdominal cavity. So here we have the ribs, the skin has been taken back, open a window in the abdominal cavity, and we use a sterile needle and syringe to try to pick up, that's what the forceps are here. We're picking up the abomasum, or the stomach in these animals. The forestomachs are very, very tiny in fetuses. So the biggest chamber that you're going to see right along here, and it's usually filled with this yellow amniotic fluid, is going to be the abomasum. So we want to get that collected. We collect that, again, aseptically as possible, using a sterile needle and syringe. And then we submit that for culture. So aerobic culture plus or minus fungal culture. And then we also perform Campylobacter culture, and Brucella cultures can be performed also. And those require special media. So once we have that collected, we open both cavities to collect a set of tissues. You can collect at this point in time the free thoracic fluid or heart blood, depending on the age of the fetus. This can be useful for antibody screening for antibodies for infectious agents, as discussed, for example, with Cache Valley. These are best shipped and placed into plastic tubes, just so they don't break during shipping. And then if possible, if you collect heart blood, if you could separate prior to shipping, that's recommended also. You want to collect a whole set of the fresh visceral samples. So we collect, we keep a set fresh and then put a separate set of tissues into fixative for histopathology, so light microscopic examination. For tissues that we collect the main organs. So heart, lung, liver, kidney, spleen are pretty important ones. We'll collect skeletal muscle, fresh piece of skeletal muscle, and of course, brain. And to remove the brain, you can use either a bone clippers or nail snips, if you will, rongeurs, we call them also, or a small saw with a fine blade. You can instead of cracking off the pieces of the skull, you can cut a head in half along that medial plane. And that's a good way to examine the brain on fetuses, even if you're not going to do further diagnostic workup, for reasons that we already discussed with some of those viral infectious agents. So samples can be pooled or sent separate for pooling at the laboratory when you collect your fresh samples. And then you want to make sure that when you collect fresh tissues that that they're at least a centimeter, cubic centimeter size, so we have enough to do the testing. If you have more tissue, better to send more than less. And additional fresh tissues, other than the ones that I had mentioned already and that are listed here. You want an extra fresh piece of liver, kind of a bigger piece that can be used for nutrient screening. And then you can submit a whole eye. That is where we would test for nitrates, although again, nitrate toxicosis and abortion, not common in sheep and goats. And then just a list of the tissues, but I think, and serum from the doe if possible, if you want to do serologic testing. Often though, serial collection is important to make sure that it's not an older infection. You want to do a serum sample and then 14 to 21 days later, get another serum sample to look for antibodies and changes in the level of antibody for infectious agents that you may be testing for. So here's just some tips on shipping and how to package the tissues. However, since we're talking about sheep and goats, they're pretty small. I would recommend sending the whole body and placenta for necropsy. That way a pathologist that receives the fetus can do a thorough gross examination as following the steps that we just walked through. And also very, very, very important, as already mentioned a few times earlier, is to submit the placenta if at all possible. Even if it looks contaminated, shake it off and send it in. So then just a little bit on what the diagnostic plan typically is after we collect samples. We use that abomasal fluid to do abortion culture panel. That includes the aerobic plus or minus fungal cultures. Campylobacteria, Brucella species can be cultured. We also perform the histopathology, so that's those fixed tissues that we receive. This in of itself sometimes can be diagnostic. I recently, granted it was a bovine case, I cultured the amniotic fluid from an aborted bovine fetus, and they had no culture. It did not grow any fungus on culture, but in looking histopathologically at the placenta, you could see where there was a true fungal placentitis. So in some cases, pathologists do a little happy dance when they're actually the source of a diagnosis for an abortion. Rather than just having it based on culture and molecular testing. So fresh tissues also are ran through molecular testing or PCR. We can do PCR for Cache Valley virus, but again, often it's not detected due to it being cleared. Border disease virus. And interesting, I didn't mention this before. I did mention that border disease virus and bovine viral diarrhea virus are very closely related. They're so closely related that the same PCR is used to detect both. And then sequencing is used to differentiate the two. At least that was the testing that was done at Kansas State. We currently do not offer that testing at the Wisconsin Veterinary Diagnostic Laboratory, though, we don't have Cache Valley virus or border disease virus PCR currently. I'm working on building our small ruminant infectious disease diagnostics since I've been here. So molecular diagnostics, or that PCR, looking for detection of the infectious agent, is also used for some of the bacterial and the protozoal organisms. So bacterial agents such as Coxiella burnetii. Most labs do not want to culture Coxiella because of its very low number of bacterial particles that are needed, or bacteria that are needed to be infectious to humans. UW-Madison, which is WVDL, is under the umbrella of that. They are very, very cautious about this agent. So we have to screen all small ruminant abortions for Coxiella burnetii prior to submitting any other testing on the fetus. So, and they usually do that within a 24-hour time period. So it's not too much of a delay the way we have it set up right now. But it is one that we screen for rather than before we try to culture anything else. And then PCR is also used for detecting Toxoplasma gondii. And then toxicology testing can be done. So on liver specimens, the one caveat to this is how useful it may be in some of the micronutrients or the vitamins that I listed. So the primary source of vitamin A for the fetus or newborn would be through colostrum. Vitamin E also. It should be detected and it may be useful, but really you want to do that testing on the dam if you suspect that there's a micronutrient, particularly those vitamins. The others, like selenium, you certainly can test on the liver of the fetus. Finish that sentence. And then just a little bit about what the Wisconsin Veterinary Diagnostic Laboratory offers and costs. So what we call a bottle necropsy is if you were to walk through all those steps and collect the tissues yourself, or have your veterinarian collect those tissues and send them in. The cost of the testing, once we get a bottle necropsy in, is $106 in-state, $160 out-of-state. The WVDL does charge a differential cost between in-state and out-of-state just because we're state subsidized in order to allow for lower cost in-state. And that's not true for all of our testing, but it is true for our necropsy cases. But again, I would encourage for just what, $122 more, or $22 more, you can send in that whole fetus and have it grossly examined by a trained pathologist, a board certified pathologist, and they can do all those tissue collections. And what we do currently here at the WVDL, we get that amniotic fluid put into a special media right away for Campylobacter culture. So even though we have that 1-day delay to get Q fever, the Coxiella PCR completed, we have the tissue set up and ready to go and in optimal conditions, ready for that next step of testing once Coxiella is confirmed negative. And the benefit, and this is a huge benefit, when I was at Kansas, it was not like this. These prices include all of the in-house testing capabilities that we have for sheep and goat abortions. So the one thing we don't offer though is toxicology testing. And like I said, we also currently don't have all of the PCR testing that you may want to have performed. But for the cost, it's pretty cost effective and worth doing the full body necropsy or at a minimum a bottle necropsy, just due to the fact that we have all inclusivity with our testing capabilities here. So that'll include, so for a whole body necropsy, that includes the gross necropsy, all of the histopathology, all of the cultures that are set up, and then the PCR testing that we're able to do in-house. The only thing that is different here than my experience at Kansas State is we require for necropsy cases, for whole body cases, and for bottle necropsies, a DVM signature. We like for cases to go through veterinarians so they can be your direct source. So they can be a producer's direct contact and direct source of information and communication, since that field veterinarian is the one that has a valid client-patient relationship. It makes diagnostic description to the producer, I think, more effective, and then a treatment plan more effective. So, but I have also listed here our website at the Wisconsin Veterinary Diagnostic Laboratory, where you can check tests and fees because they do get updated. Most diagnostic labs have adjustments annually just due to inflation and costs of supplies for doing the testing. And so I would recommend checking out the costs and what testing that we do have available by going to our Wisconsin Veterinary Diagnostic Laboratory website. And we always welcome questions, and that's from referring veterinarians, so producers, field veterinarians, and from producers also. So you're always welcome to call in and talk to one of the pathologists. You're welcome to ask for me directly. We do have another, I would consider, small ruminant specialist amongst our group. He is one of our case coordinators. He's a boarded internal medicine specialist, large animal specialist, and that's Dr. Ryan Breyer. He knows quite a lot about small ruminant medicine and infectious diseases and other disease entities. So request to talk to either Ryan or myself if you'd like, or really any of the pathologists can help you out. We have laboratory locations for those that may not know this, in Madison and Barron. So both areas are covered, I guess, to cover more a wider portion of the state. And we have more testing that's done in Madison than at Barron, I would say. We each specialize in certain testing. But if you submit to Barron, they would ship samples down for molecular. They don't do the PCR molecular or virology type testing up in Barron. That's Madison. So with that, I'll thank all of you for attending, and hopefully you picked up a few points from that rapid pass by of abortion and pneumonia. And here I've provided my contact. Again, I welcome phone calls. This is the WVDL general number that I have listed here. And you're welcome to ask for me and or reach out via email with any questions or concerns or anything that we may be able to help you with. And just a quick thank you for all of those necropsy pictures. I had two amazing residents when I was in Kansas, pathology residents, Dr. Alex Ford and Gianelli Rodriguez Ruiz. They helped take that series of shots to going through gross necropsy. And I think that is all I have then, Carolyn.
Yeah, great, Maggie. Thank you. So we do have some questions in the Q&A. I've been not wanting to interrupt you. And you can see them, but I can also read them for you and for the audience. And some of them we're going all the way back to the beginning, but I think it's fine. So the first one is, what's the prevalence of mites bringing in mycoplasma issues?
So mycoplasma, one that I don't know. So ovipneumoniae, I would say no, the respiratory one. I do not think they bring that in, that anybody's ever looked at or found. A mycoplasma that they can transmit, though, because they bite, would be one that I didn't talk about, and that's Mycoplasma ovis. That's a blood-borne bacterium that can cause anemia and jaundice in infected animals. And I'm not familiar with them transmitting the other mycoplasmas like the putreficans, etc. That's not to say that they might not, but not that I'm aware of. But I do know biting insects and arachnids can transmit the blood-borne mycoplasma, which is Mycoplasma ovis. which used to be called epi. A lot of people may know it as epirythrozoan, but it's Mycoplasma ovis now. So I'm probably not a lot of help on that one. Barn cats would carry oocysts. Most farms have barn cats. So you're talking about toxoplasma. Do you mind if I
Yes,
just
that's-
read these?
Yeah,
Okay.
no, it's fine. And I kind of remembered when they were coming in. So yes, we were talking about toxo.
Yep, so toxoplasma in cats being carriers. So the interesting fact about cats is they're reported that they only shed once in their life, and it's for a 1 or so week period. That's what I remember. So yes, they can carry and they shed it in their feces. And barn cats probably are one of the primary sources when you see sporadic abortions due to toxoplasma. And most farms do have barn cats. Kittens that pick it up from their dams, even though the dams still carry it, and they can carry it in their muscle without it doing any damage to the muscles for cats. When they have kittens, they can transmit it. I believe it's through nursing those kittens. And then at some point in their life, a kitten will shed it, and then they're supposed to never shed it again. So it's kind of that hit or miss. And again, why it's probably related to just sporadic abortions. And I don't know percentage, but they do say upwards of almost 100% of cats, outdoor cats, probably carry it in some form and have shed it at some point in their life. Why seemingly healthy doe would abort prior to 30 days post-bred. What are some of the main reasons why a seemingly healthy doe would so really early term? I think we covered a few of them. So some of the viruses, if they infect early, those are kind of the primary ones that I think of. I think ovis potentially, Brucella ovis. If you have, you may want to check doe serum to see what we can rule out or rule in via serologic testing. I think that may be the best route for that. It seems like a lot of the agents that I covered really are more late term, especially like the toxo and the bacterial agents. So I think I may have.
Yeah, I think that one came in kind of before you went through some of those. So that's good.
I would say virus is more, unless I can't say that an ascending bacterial infection wouldn't cause an early absorption and mummification, but I think of viruses when to be on my top of my differential for reabsorption and mummification. Anyone in particular more than others? Is there more? So yeah, just the viral agents that I listed. And as far as bacteria, no, none more common, I guess, than others in this area. I'm really curious. I had 2 producers, without naming any names, talk about Cache Valley this past year, and with lambing that's occurring right now, and having problems that grossly look quite consistent with Cache Valley. So I'm wondering if we had an uptick in it this past year. What are good steps to take if I suspect ovipneumoniae is in the flock? I think I understood you to say it is difficult to identify in living animals and only secondary bacteria are susceptible. Does that mean culling is the best route? Oh, Mycoplasma is a tricky one. So I've had some experience with trying to clear Mycoplasma ovipneumoniae in Alaska and some sheep and goats, just because they had some policies go through that were requiring testing, and import is really difficult. I don't know, and I know that a couple of herds actually ended up killing every one of their goats because animals shed periodically. So who are you going to euthanize and not? That's an entire topic, and an anonymous attendee is the name on that one. if you don't want to be anonymous and you want to call me, I am more than happy to discuss my viewpoint on the bane of my existence of a bacteria. So that's not a very specific answer for you. It's a tough question. Tough questions. Anticoagulating. For serum, you want the red top tubes, so the ones that coagulate. And then can you explain why you? Yep, it's exactly why we test for Q fever first. UW-Madison, like, we never considered that at Kansas State, and we know we keep it under biosafety cabinet, but UW-Madison has some pretty stringent and a great fear of Q fever. So it's zoonotic. It's not only zoonotic, it's an abortogenic for humans too. So it causes human abortion. So it causes some fear, I think, in people. Thanks for the plug, Maggie. Glad to help any. Ryan. Morgan, are we able to get a copy of the PowerPoint? I'd be happy to share the PowerPoint also as a PDF, and I can share that. I'll clear up a couple of weird typo things that ended up in there, but I'm happy to share that, Morgan.
Yeah.
And I can send that to Carolyn to send out to whoever would like it. Do lice transmit anything? So biting lice, again, they can transmit Mycoplasma ovis, that previously called epirithrozoan or epi. That's the one that I think of when I think of biting lice. I don't know if they can pick up and transmit. The other I would maybe be concerned about is Corynebacterium. So the caseous lymphadenitis, causative agent of CL in sheep and goats. I don't know if that's been looked at a lot, but that's another one that comes to mind that can enter through abrasions in skin. Are there vaccines that can prevent any of these diseases? Blue tongue, I believe. And yeah, there's not for the herpes, and that's probably
I can jump in and just.
thank you,
So
Todd. I'm
yes,
like, that's a clinical question.
So yes, we do vaccinate here at the research with the research flock for Campylobacter.
Okay.
We have used chlamydia vaccines before, but some of those are more herd or flock specific. So unfortunately, the efficacy on some of those may not be real good if you just order over the counter on some of them. I'm trying to think what else. Oh, is it lepto? That's another that we can vaccinate for. But yeah, the chlamydia and Campylobacter are really the two that I think of that you can. Unfortunately, things like Cache Valley, some of those, there are not currently vaccines available. One of the exciting things at ASI convention last week was that there was a gentleman from Indiana that stood up and said that he is working on a Cache Valley vaccine and is hoping to have it available in the next 2 to 3 years, hopefully. So problem with sheep vaccines in the US is there's not enough funds to get them developed and approved for sheep, but Cache Valley is one that's hitting enough of the flocks that like to lamb early in the winter and late fall, and when the mosquitoes are breeding, when the mosquitoes are at their high point, that there's some push to try to get a vaccine developed for that. So hopefully that's some good news and we'll see that coming. As Maggie said, I was one of the ones that's reported some of the problems with Cache Valley this year. So I'm hopeful that the picture that I sent was one from our personal flock that we've had a little bit of issue with, not extraordinary, but we've had enough issues that I'm hoping I can get away from having to deal with it next year. So hopefully that answers your question. There's not a lot of vaccines available, but there are a few for some of those. Toxo, there's not a vaccine available. We used to try to use oromycin crumbles to help fend that one off, but again, those are restricted now, just like all of our antibiotics are restricted now. You do have to go through a veterinarian to use those substances. So again, if you think you have an abortion problem, talk to your veterinarian, develop that relationship, and they can help you out with some of those.
So there's one other question. Would any of these be associated with poor conception rates during the breeding season? Poor conception, definitively, I would say Brucella ovis is one that pops into my mind. Todd, if you have any to throw in there, but what may seem like poor conception may be early absorption of the fetus or loss of a fetus prior to even knowing that the animal was successfully bred. And that would be some of the viruses that are early.
That's what I was going to add too, Maggie, is it's not so much poor conception other than the B ovis, because that's affecting the fertility of your ram that's breeding those ewes. The one thing we have seen in addition to these lambs that we've seen with Cache Valley symptoms is we had a group of ewes that we bred these ewes back in August, ultrasounded them in early October. They were all confirmed pregnant, came back and was getting them off of pasture and ultrasounded them again in November, and they came up open. So they had some early absorption. These are all out of the same group. So I suspicion that the Cache Valley took some pregnancies there as well. And those ewes were able to just reabsorb, and it didn't carry the lambs to term. Unfortunately, we had more open ewes when we came off of pasture than what I wanted. So that's probably what you're seeing, not so much conception, but early absorption or early termination of the pregnancy and reabsorption, or you'll never notice that they aborted.
I think that was it.
Does anybody else have any questions? You could raise your hand and I can try to unmute your microphone, but I'm not sure if that's working right now.
Yeah, I see this. And Angela has a question. I don't know if we can unmute her or.
Yeah, I tried to unmute, but it's not letting me at this time.
Yeah, I don't see, if you guys can type in those questions either into the chat or the question and answer would be great, because because of the platform we're using, we're not able to unmute you so you can talk.
Yep, and the chat's actually not working either. It's just the Q&A is the only way.
Angela said, okay, sorry for it. It's a user error, so.
No, that's okay.
All good.
I didn't know that at the beginning either, so we had a lot of things to figure out before we started. Yeah, thank you everyone for attending. I don't think I see any more questions coming in. Oh, she said she had her hand raised by ear, so no problems. Thank you, Angela.